Hospitals in Boston are joining a national effort to gather information for improving health and research. Part of the plan is to learn more about the way health conditions are affected by differences in lifestyle, environment, and biological makeup. To tell us about the research program known as All of Us are the principal investigator from Boston Medical Center and Boston University School of Medicine, Dr. George O'Connor, and the co-investigator from Mass General Hospital, heading the Research Center for Community Access, Recruitment, and Engagement, Jonathan Jackson. Thank you both for being with us.
Thank you, Chris.
Thank you.
I want to start with Dr. O'Connor. The name is very catchy, All of Us, but what does it mean exactly?
Well, I think the name, the All of Us research program, was adopted because of the importance of the concept that we all need to participate in it for the program to be successful. Since the program tends to look at the personal characteristics that affect health outcomes, the development of health conditions, response to various treatments, there needs to be diversity of personal characteristics among the volunteers in the program for us to be able to get these insights into what are the personal characteristics that influence these health outcomes. So the idea of All of Us is that we need a very diverse group of volunteers, diverse in terms of their family background, diverse in terms of their history of medical conditions, in terms of their medical treatments, diverse in terms of their environment and occupation. All of us really need to participate in the program for it to be successful.
And it sounds as if you're talking with people who've been underrepresented in research for decades, probably.
That's exactly right. You know, there's been a problem, unfortunately, with minority groups in this country being underrepresented in clinical trials and other forms of medical research, and All of Us is attempting to resolve that problem.
Dr. Jackson, this is also part of an initiative called Precision Medicine, and what does that mean exactly?
So precision medicine just refers to the idea that we're trying to move beyond the one-size-fits-all approach. So all three of us are wearing glasses. We probably don't have the same prescription, and it wouldn't be helpful if we were just all offered the same prescription. We also don't have the same shoe size, and we would also be uncomfortable if we were all forced to wear the same size shoe. So the same idea applies in medicine when it comes to our health, that sometimes we need slightly different approaches, slightly different therapies, tweak on the basis of our lifestyle or our genetic code to help deliver the best therapies at the right time.
Dr. O'Connor, what kind of things are you going to be trying to ask people to build the data for this study?
Well, we'll be asking about medical history. We'll be asking about lifestyle such as diet and exercise. We'll be not only asking questions directly of the participants, but we'll be asking them to share health information from their health record. So we'll have information on their health conditions, the medications they've been treated with, perhaps the allergies they've had to certain medications, which therapies have worked, which therapies have not worked, as well as blood test results that may have been done in their, by their primary care doctor or in their hospitals. We're asking them to share a variety of information from lifestyle to diet to very specific medical information.
Jonathan, when most people see their primary care doctor, you're asking questions that are maybe very similar about your lifestyle and your diet and so on. So how does having this aggregate pool of information change the nature of those conversations down the line?
So it changes it for a couple of different reasons. One is that the All of Us research program is trying to collect those kinds of responses from 1 million people and follow those 1 million people for 10 years. So we get to see not just how that information is collected at one point in time, but over a decade and probably longer. So the hope is that by collecting all that information and being able to say, the people in this region seem to have a higher prevalence of allergies of this particular kind, or there's some kind of pollutant in the water in this part of the country and it's having this kind of response on the health outcomes. By being able to look at that data from so many people over such a long time, which is unprecedented, we'll be able to really be kind of narrow down different sorts of precision or precise kinds of tools and interventions that can help people at a very individual level.
Dr. O'Connor, if someone takes part in the study, what exactly do they have to do?
Well, the first step of enrolling in the study is to read about the study and complete the informed consent process, because we make sure that all volunteers are fully informed what is involved in being in the study before they join. Having read about the study and completed the informed consent process, there's a series of questionnaires that are completed. They don't take too long. They can be completed online or in person at one of the enrollment sites. followed by, after the consent and the questionnaires, a participant undergoes a series of routine clinical measurements such as blood pressure and height and weight. And finally, a blood specimen is collected and a urine specimen. These are sent to the biorepository for the All of Us research program and will ultimately be used for testing to research the various health conditions that will ultimately be done.
Jonathan Jackson, this is a national study too.
Yes.
Can you imagine what kind of things we might find out from this to change the notion of things nationally?
Yes, so it's hard. I think we often struggle in trying to outline exactly what kinds of breakthroughs are possible. But there's a couple reasons why it's hard to articulate. So number one is there's nothing that's ever been done on this kind of scale before, so it's unprecedented. The second thing is that when Dr. O'Connor and I talk about All of Us, it's not just all of us are giving our data to a bunch of scientists and walking away. It's that all of us are also involved in the process of oversight and the process of study development and the process of discovery. So the All of Us research program will also be giving back these large parcels of data back to citizen scientists, back to the community, so that people like you, people who are sitting in their homes today, who have an interesting research question, can look at the data and develop their own discoveries.
This is BNN News, and we're talking with Dr. George O'Connor from Boston Medical Center and Jonathan Jackson from Mass General Hospital. Dr. O'Connor, talk about the potential for advocacy around health. When you have this data in your hand, and you can say, that there's a racial divide or a class divide or something involved, can that really help people?
Well, I think so. As Dr. Jackson said, there'll be opportunities not only for university-based traditional researchers to analyze the data, but for community groups, for health centers, for citizen groups to analyze the data. And we've long recognized that there are disparities between different subgroups within the United States in terms of health outcomes. This will be an opportunity to have a large group of volunteers who are sharing their health data that will give us a better insight into those disparities and what are some of the factors that underlie those disparities, be they environmental or genetic or access to care.
Right, and finally, Jonathan, if people want to take the next step to get involved in this, what should they be thinking about?
Well, there's a lot of information online, so the best website is www.joinallofus.org.
All right, thank you both very much for being with us. Jonathan Jackson and Dr. George O'Connor.
Thank you very much.